hope you're doing well and getting some rest this week. In this module, we start to talk more about biopsychosocial assessment, which is not only necessary in our own practice as social workers pretty much daily, depending on what type of job you do, but also important as this is our final assignment for this course. And learning how to do these types of assessments is really important, but also somewhat intimidating at times because it requires so much information gathering, but also information sifting, really. We know that not everything about a person is important as we are working with them for therapeutic reasons, if we're doing an intake assessment, but all that information, some of it we can sift out the important pieces and it can tell us a little bit about that person. And all the information we gather isn't always told to us, it's observation as well. So being ever observant is very important. For example, I can think about if we talk about my phone case, does it really tell you a lot to know that it's pink? Probably not, but it does tell you something else. It tells you that I have an iPhone. Even an iPhone couldn't mean too much, but it tells you that I have talk and technology capability, which reduces some barriers to care. So if I were going to an appointment, I could call someone. You might assume I have some disposable income based off the fact that I have an iPhone, or that maybe if I don't have that disposable income, this is something I find to be a basic need, even if I don't have a lot of money to spend on other luxury items. Another important factor as we're talking about biopsychosocial assessments is environment. So I like to share an example about a young teen I recently saw. This teen had a lot of conflict with her mom, and the teen struggled with using marijuana as well as depression. I was only able to see her in a medical setting. A few hours later, I received a call from an EMS driver medic that transported her to the hospital that wanted to relay some concerns about the teen's home that they came from. He said that they retrieved her from a home that was completely littered with cockroaches, had no heat, and there were bed bugs visible everywhere. Does that change any information during our assessment? Now I have a little bit more that I can gather from this information from her. Perhaps are there financial challenges? There's definitely some home concerns with the cleanliness and the hygiene of the home, but also not having heat. That's a safety concern in the winter as well as a financial concern. So in this aspect, we can really open our mind to other questions we might ask during that clinical interview with that teen and the assessment that we're gathering. So tell me about where you live. Is that comfortable to you? If they say yes, okay, tell me what comfort looks like to you. And that's not a method of trying to trick anybody or challenge anyone's appreciation of comfort, but really, what are they willing to divulge? But also, is this a home that is perhaps comfortable to them, even though it might not be suitable to our own standards? If we think about that kind of from a wide spectrum, we can think of maybe if someone was without a home for several years and this was the option they had, was a place that was littered with bed bugs and roaches and no heat, maybe that would be suitable to them compared to what they were living in before. So it's important to really think of different contexts that can tell us about. We also see that a lot with refugees in the U.S. So we might expect refugees off our first thought to be happy just to be in the United States compared to where they might have come from. But we often forget that a lot of the housing they're provided with are in some of the most dangerous areas in some communities. So maybe they feel safer just by being in a different country, but do they feel safer in their own four walls? That's something we never want to assume, but we really want to ask questions about. And as you move through your career, you'll learn creative ways to ask those questions. When we talk about sources of data when we're gathering our biopsychosocial assessment information, of course we use the client, but we know that not all clients are totally reliable. We've all probably talked to a client before, maybe in a mental health crisis, and they say everything is fine, despite we knew earlier they were exhibiting active psychosis or had a suicide attempt earlier that day or that week. So sometimes we need different sources of data to gather information from. And these can be different people, different agencies. It really just depends on the person. If we use a 10-year-old child as an example, we might think of obtaining information from their teacher, their parents, their coach, their pediatrician. For a teenager, maybe their probation officer, their parents, foster parents, whoever they're surrounding themselves with, or big brother, big sister. For an elderly person, we might think of maybe their physician or their psychiatrist, their home health care aide. So it's important to remember that our clients also have different types of relationships than you might have, whether it's social, romantic, family relationships, and we need to be open-minded to that as well. I once saw a patient with very complex medical needs whose dad, who was with her, was not her biological dad, but had been caring for her since her birth. And it was her mom's estranged boyfriend, actually. Uh, Her biological dad saw her about 3 times in the last couple years, and this child was only a few years old as it was. The dad she was with knew way more about this child, her medical needs, than her biological dad. So just because that person wasn't biological to her, he was a reputable data source. When we think of maybe talking to someone's paramour or boyfriend or partner, girlfriend, whatever their romantic relationship is, what is their relationship like? If this is someone who maybe is abusive or violent towards our client, is there a likelihood that this partner might not be providing accurate information about the client, especially when we understand the dynamics of domestic violence? Or is this someone who sometimes we see clients, depending on the setting you're in, that go through a lot of romantic relationships fairly quickly? So if this is, if you're working for Children's Services and you have a mom that tends to have a new partner every few months, is her partner of the last 2 months someone that's reputable to give you a lot of insight to her mental health? Maybe, but also it's important to be mindful of that. Further, we'll be working to assess many other components of a person, including their physical functioning, their cognitive functioning, their behavioral functioning, what's their motivation to seek help, what are their values, and what's their culture. I recently had a situation where parents in their 20s had a 4-week-old infant that had an arm fracture. And we know that 4-week-olds really shouldn't have arm fractures, and they can't cause them themselves based off their development. However, these parents were certain that the infant caused this fracture on his own despite only being a couple weeks old. And that initial statement told me that perhaps the parents had a poor understanding of infant development. Maybe they had a lack of parenting education prior to having the baby. But through further assessment, both parents informed me that they had IEPs during school, and one was diagnosed with a learning disorder and told me that he also had a cognitive delay. While I wouldn't have wanted to assume this just based off the initial report they gave me, I was able to ask some questions that led them to discussing that with me. Tell me what your education is like. How do you best like to learn information? Is it written? Is it verbal? Tell me about your schooling. And that's when, after that report and those questions continued, they were able to tell me about some cognitive delays, which painted a much different picture than what I initially assumed. As we continue to talk about different questions that we're asking, it's important to remember that we don't want to just rapid fire questions at people, but people always aren't going to be offended just because we're asking questions that are personal. And that's why that rapport piece is so important. When we're showing an interest in people, we're more so able to ask some of those questions. I hope this was helpful. If you have any questions, please feel free to reach out to me.